The AMA chief, Dr Omar Khorshid, has outlined the association's blueprint for fixing Australia's fractured health system today in a speech to the National Press Club. Doctors want to learn from the health lessons of the COVID pandemic and use it as an opportunity to make the system more sustainable. Earlier I spoke to Chris Moy, the Vice President of the AMA. Chris Moy, thanks for your time and good to see you in person finally. A big scene-setting speech from the President of the AMA today. A few things to go through. So telehealth was this thing that changed overnight during COVID. What's the next bit of reform sitting there ready to go that could take years but should take weeks?
Look, I think COVID is an example of something that's actually forced something like telehealth. I think that COVID has taught us a few things, that we can do stuff like implement telehealth quickly, but also a whole number of things that health advice and also proper investment in health is actually an investment, not a cost. Because I know that there's been a lot of naysayers about, throwing more funds at, doing certain things in Australia recently. But if you really think about it, Australia's plan in the end has not only sort of saved Australian lives and protected Australians, but it's also helped the economy. And I suppose what Omar Khorshid would like to do today is actually set out that story, that's just a microcosm of a much bigger thing, because there are other big health issues that we need to, first up, take that health advice, but also invest and view it as an investment. So
is there another telehealth, or is that just one of these easy ones that there's no sort of zero-sum game? The rest of it will take some convincing.
Okay, so I'm talking to a hard-edged, cynical journalist here.
Sure.
Okay, so what we have is actually a playbook. This is actually a playbook. Now, it's essentially a list of things that are, many of which have been discussed before, which we've discussed out there, including telehealth and progressing with digital health technologies, to really move Australia forward.
Okay, well, let's go through some then. Prevention. Everyone sort of agrees, every expert agrees it's a great area to spend money in. Economists say it's smart as well. We don't seem to do it. What are specific prevention areas we should be spending on right now?
Well, let's talk about obesity, number one. Obesity, Australia is one of the most obese countries in the world. Now, let's talk about the flow-on effects of that. As we get more obese, then we have greater pressure on general practice trying to manage the critical sort of problems with that, like heart disease, strokes, heart attacks, amputations, eye disease, kidney disease. But that flows on to hospital admissions, that flows on to surgery, renal transplants, things like that. So, I mean, there's a flow-on effect. So the issue with us in terms of COVID was getting ahead of this. So very much what we'd like to do is actually get ahead of this as well. Now,
what does that mean? I mean, we get debates such as sugar tax. We get people saying, let's get people more active. Is it carrot? Is it stick? Where should this money be spent on obesity?
It's a bit of both. So the first is, I think we do need something like a sugar tax on sugary drinks. That's a low-hanging fruit. It's a signal to everybody that sugar is an issue. Look, there's a cost in the amount. It's crazy that for many of us, buying a carbonated sugar drink is cheaper than water. And so the AMA would like to see, for example, a sugar tax, which is then put into, for example, greater access to clean water in Indigenous areas, for example, which is the problem. It's crazy that people are forced to drink carbonated drinks because they can't get access to clean water.
So once those groups go to buy something, buying water seems crazy, so they buy a soft drink because it almost seems like value. If it's more expensive than water, that changes.
We live in a perverse world where the cost of things actually forces us into bad decisions. So that's a simple one.
Hospital funding, you're going to revisit this. The government seems pretty settled on this. Do you think there's going to be any joy in terms of changing the parameters? The 50-50 as it's set right now.
Yeah, we need to get that. Yeah, we need to get that Commonwealth funding up, because look, at the moment, I think all the states have suddenly realised at the moment, this is while we don't have any COVID out there, we have hospitals that are across the country ramped full to the brim. Emergency departments not able to cope at the moment, and the hospitals full to the brim. Now, what's going to happen in next year, say, and we do get a reasonable amount of our population vaccinated, but still some people not vaccinated, and we open up and we start getting COVID cases.
Well, what will happen?
Well, we're done like a dinner at that point. These hospitals won't cope at that point, because really they're in a situation where they can't cope now. And as you can see, one COVID case in a hospital requires a lot of capacity to manage each individual.
Right. So you think without more funding, ICU in particular, but hospitals will not be able to cope if and when we open up, even if it's just a few COVID cases in each state?
We can't cope now, and we're at the beginning of winter. So if we get a bit of flu, we're already going to struggle. But we do need to look, and this is I think it's interesting, because I think National Cabinet has actually lit a light in the minds of a lot of the state premiers, because I think they realise they've all had the same problem and they really do need to get together.
All right. Just want to get to some general stuff. The vaccine rollout, how's it going? Is it more on track than it has been in previous months? Still big issues? Where do you sit on this?
Well, I think we're starting to cook with gas in terms of the numbers out there. So we're getting up into that sort of 150s, getting towards 150 a day sort of number. We need to get it up to 200. I mean, last week I think we got over 1 million last week. So we're sort of getting sort of good numbers as far as the rollout. It's been difficult in Victoria. I think Victoria has been a very... I mean, I feel very sorry for everybody in Melbourne because to some degree they're the ones that have suffered the most through this. But to the same degree, what has actually happened, in fact, is actually lit the fuse and got people to understand why. I think the reasons for the vaccination in the minds of a lot of people hasn't been there, but that's actually helped now. And I think it's also helped the rollout side of things.
Pharmacies very keen to get involved. You're part of what is a lobby group for doctors. Do you have any issue? Is it a turf war, or are you happy for them to be involved in really turbocharging?
Well, all I can say is I'm a general practitioner in my room, and trying to talk to patients about their vaccine is already very difficult. I need to know their medical history. I need to be able to talk them through the medical aspects of it, and then they need to have confidence when we give the vaccine to them in a nice, safe environment.
Can't you funnel easier cases, much more straightforward, young, healthy people towards pharmacies, though?
Well, part of the problem at the moment is that despite the fact that general practice has actually done most of the vaccinations so far, it's about 2.8 out of about 2.9, I think, out of about 5.2 million shots as of yesterday. Only half the general practices have really been in play so far. So we've actually still got a lot of capacity in that area. It makes far more sense to put them into play at this moment in time because they're ready to join the fight. And that's how general practice feels.
But it also might be just about the sort of people that go, can't be bothered going to the doctor, my pharmacy's there, they'll do it, I've got no health issues. Again, more the merrier, isn't it?
Well, look, I would say to them that, that I think that's an argument that's put by the pharmacy, but I'd be worried about trying to do this in a COVID-safe manner in the middle of a pharmacy, for example, and without the necessary medical history about a patient beforehand, and being able to have the privacy, for example, to talk through the various issues with the patient. Because I'm going to tell you now, forget about the people coming in for the vaccination clinics. I'm talking about every single consult almost somebody's talking to me about.
But I mean, they do flu shots. That's not a problem, is it?
Well, do you think that flu shots have been around a while, and I think to some degree people have kind of accepted that. I think the level of anxiety regarding the COVID shots, although I think there has been unnecessary amounts, has actually been a material issue in the rollout, and I can say day to day it's an issue.
Just wanted to ask you finally about Anastasia Palace. She got Pfizer in the end. All of this, there was lots of timing, and there was a flu shot. Dog bit her, the Tokyo Olympics, but it all seemed to stem from the fact she didn't want to get a jab very early on when it was available. She said she didn't want to skip the queue. Other leaders were getting the jab as an example to others. What did you make of what she had to say?
Look, as a 54-year-old who went to have the AstraZeneca with no problems, because I know it's a good vaccine and we're lucky to have it, and also from the point of view of a doctor trying to really encourage the rest of the population to get their shots, it's become a problem. And I think,
what she's done has become a problem.
Yeah, I think it's sent the wrong message, unfortunately. I think what I'd say is it's frustrating, but, it's been interesting amongst my colleagues, for example. I was the former ethics chair, for example, and I really have had to say, as doctors, we must never use our position to advantage for myself or a patient or, a family or friend to gain an advantage to jump the queue or get something. All I'd say is that the same level of scrutiny, which would be that my case would be considered, needs to be considered in her case as well. I think, and that's at two levels, pub test, but also, I think we just need to have a good look at what the reasoning was.
Dr. Chris Moy, thanks for your time.
It's a pleasure.